Good morning, good afternoon, good evening, depending where you're joining us from. Welcome to the Africa CDC weekly media briefing on public health emergencies in Africa. This platform is set out to facilitate weekly engagement with members of the media and the public to provide recent updates on health emergencies that are occurring across the continent. This week, we are focused on the Margaret situation currently ongoing in Ethiopia. Of course, the Mpox outbreak in multi countries across the continent. EVD has been in DRC for a while. It has been declared over just this week, and many others that are popping up. As usual, we have speakers from the Continental Incident Management Support Team based out of the DRC that are here to support us. Today, we have with us Professor Yabum II. He is the Deputy Head of the Incident Management Support Team in DRC. Prof. Yab is going to be speaking to us this afternoon from Cameroon. And so we are set to bring you updates regarding all of the emergencies that are happening on the continent as we gradually go into the holiday, end of year holidays. My name is Nike Ongwel. I'm sitting in for our usual moderator, who is not in today. Just before we bring in Prof. Yap to begin the section, let me remind you that we have English to French, French to English interpretation on the section. So you can go to the language icon and choose your preferred language for better understanding of this section. Thank you for joining us. Let me now bring in our speaker for today, Prof. Yap. It's over to you.
Thank you so much, Nick, and happy to have you as our moderator today. So once again, I'm pleased to conduct you for this press briefing on behalf of our Director General, His Excellency Dr. Jean Kaseya, who is currently in Japan, where he's attending a high-level meeting on the universal health coverage. So we'll go through the current situation, and then you will see that there has been some very positive outcome, as mentioned already, with the declaration of the end of the Ebola outbreaks, but also how we learn from those ones to respond to the other outbreaks that the continent is facing. So we are at this time where the new vision of Africa CDC, of Africa Health Security and Sovereignty agenda needs to be disseminated to the different partners, to the different member states, so that we have a common understanding of what we mean and what is expected. So the idea is really to provide a clear roadmap to strengthen preparedness, expand local manufacturing, and invest in digital and financing system for long-term resilience. So this is really what our Director General has been pushing and disseminating to ensure that this new vision is being spread across the continent and across the globe. And what he has also added is that progress requires shared commitment, with Africa leading and partners aligning to build a more secure and sovereign health future for the continent. Next slide. You remember last week when we had the brief, there were a couple of questions on the engagement with the US government. So, and we promised that we'll bring you more information. And indeed, our Director General, the DDG, and other leaders from the Africa CDC welcomed Jeffrey Graham, which was the Ambassador Sullivan, and the US mission to AU team to Africa CDC headquarters to strengthen the health security collaboration. As you might know, a memorandum of collaboration has been signed in 2022 with Africa CDC, and it was really the time to pause and to see how the organization has improved, has changed tremendously in terms of management, in terms of operation, in terms of partnership, moving from 7 to 10 partnership to more than 48 as we do have now, but also in terms of how we manage our resources with the 9 audit that we've been going through just in 1 year, but also the approval, the alignment that we just received from the UK government and the FCDO, emphasizing that Africa CDC is an institution that has the capacity to manage those resources. So it was really the good opportunity to highlight where we stand, but also to better understand the new America First strategy and to see how we can overlap, how we can align. And of course, as mentioned, the bilateral meetings are still ongoing. The target was to 16 countries. There are still some few countries to be visited by the US government. And after that, we will have that meeting following the one that Dr. Kaseya has held before the different visit to pause and find out with the member state what is their feeling, what are their perspective, and how as a member state organization, we can support them on moving forward with this new partnership. Next slide. In Algeria, our Director General and leadership has attended the African Ministerial Conference on local production of medicine and health technologies. As you remember, one of the key pillars of the new vision is the local manufacturing. So it was critical for us to highlight that it's a crucial moment as countries unite to accelerate local manufacturing, reduce dependency, and build a resilient ecosystem aligned with Africa health security on one side, but also sovereignty on the other side. And it was great to see the progress, and we congratulate the government of Algeria for its leadership, particularly on the creation of the Ministry of Pharmaceutical Industry, which increased locally manufactured health commodity from 44% to 82%. This is quite impressive. And knowing that other countries, Egypt, Senegal, and others are moving forward that direction, it's important for Africa CDC to reaffirm our commitment to really champion the innovation, strengthen partnership, and promote long-term investment in Africa's public health future. Next slide. As mentioned, we had some good news. It's important as we go toward the end of the year to also appreciate the effort that has been implemented. This one is in DRC with the declaration of the end of the 16 Ebola outbreak that happened in DRC, specifically in Bulape. So that happened under the leadership of the Prime Minister, Judith Sumiwa Tuluka, and our DG emphasized that the success is the result of exceptional determination and exemplary coordination. And this coordination is really the work that has been done on strengthening the National Public Health Institute. Those entities, institutions that bring all together all the different capacity, the laboratory, the surveillance, the response, and so on, and bring around them all the partners to respond to those outbreaks. So I think the ENSP has been congratulated also on the different partners that came on board to support. Remember what we mentioned a few weeks ago? Africa leads and multilateral organization support. This is a very good evidence of how this concept, this vision can actually be implemented. Next slide. Now, coming back to other public health events, you can see that slowly but surely we are getting toward the end of the year. And then so far we have 186 moderate to high risk event as compared to 219 in 2024. As you can also see, the high and very high risk event are 58, while last year we have 72. So we hope and really believe that on pushing on the prevention side, our aim is really to reduce those numbers so that we can prevent and reach to a level where we can see also the number of events reduced because of a better and more efficient preparedness. Next slide. Marburg virus disease in Ethiopia. So far, 1,018 sample has been tested. 13 cases has been confirmed. 8 deaths has been observed with 62 case fatality rate. So as we do speak now, we have 2 zones that has been affected. The first one, which is the epicenter in Jinka town, and the second one in Awassa, in the south region of Ethiopia. So what can be mentioned is that the country is pushing its leadership with some partner to implement the response, the contact tracing, the active search, which is still ongoing. And as you can see, as I mentioned earlier, they've really significantly increased the testing capacity. Now, the country will adjust now that we are moving with the outbreak. It's critical to adjust and ensure that we have the proper case definition and therefore have the most efficient testing strategy. Out of Ethiopia, as we also need to support the preparedness, especially in Sudan, that is quite close from South Sudan, quite close from Jinka. Following the activation of the EOC, quite a number of action has been implemented. The training of the EOC, they received some new equipment, new materials. So it was critical to take advantage of this outbreak to strengthen the preparedness. The rapid assessment has also been done, and some reagent based on the needs might be provided to the country. Next slide. The situation of Mpox in the continent. So we keep seeing the decrease of Mpox. As you can see, the number of suspected cases has decreased from 448 last week to 310, as well as the number of confirmed cases that has reduced by 65%. So what is also important to highlight on the side of a country like Sierra Leone, we can see that now they've last 35 days without having any case. And next week on the 10th, the Emergency Consultative Group of Africa CDC will sit to review all those evidence, to assess how the outbreak has been evolving, and therefore to recommend to the Director General whether the Mpox should remain or should be lifted as a public health emergency of continental security. So once that will be done, the Director General will consider the recommendation and then will decide on the best way forward. Next slide. Now, looking at the highlights, especially the country that where we still see some increase, but we can see a stabilization which is happening in Liberia. As you can see, the change is around 11%, while at some point we were really seeing a more important increase. Same for Burundi, that has been going down, but last week we've seen a slight increase, but quite stable. Now, overall, the pattern indicates a continued continental shift toward declining transmission in most countries, with residual localized increase concentrated, as mentioned already, in Liberia, and then some slight rebound in Burundi. Next slide. As Sierra Leone is concerned, and as we mentioned, we keep on following the number of weeks that they spend without seeing any positive case. So now it has spent 138 days, which is the highest in the district of Karen. In the district of Bombali, that has the lowest, it's 36 days since the last confirmed case. So the monitoring is ongoing. As you can see, the testing coverage is still 100%, testing rate 100%, meaning that there is a continuity on the surveillance that reassure us on the figure that we are seeing it here. Next slide. In Burundi, as mentioned, we've seen some few rebound last week, but gladly we see the decrease from 16 confirmed cases to 6 confirmed cases. In total, the country has confirmed 4,591 with only one death, with a case fatality rate of 0.02, making one of the lowest, if not the lowest, in the continent. So the rebound that we've seen happen in Bujumbura City Hall, which is the most affected country with 62% of the case. So we are sending a team for the IMST, joint mission to strengthen the country response in the area of WASH, surveillance, and case management. As you can see, and you will see later, we are here talking of a mission supporting the integrated response to Mpox, which is quite going down, but to cholera as well, as will come later during the presentation. Next slide. Now, in Ghana, where we also have another team that has arrived yesterday to support the country response specifically on the area of vaccination, surveillance, and a bit of case management, we can see that the number of cases are going down as well from 46 last week to 11 this week. We can also see gladly that the testing coverage is 100%, testing rate 100%, and the test positivity rate is 34%, which is important, highlighting that the surveillance is actually happening in the community. When we are around 30%, then we are on the good side. But when we have a test positivity rate of 1%, it also means that we are spending a lot of tests for people that might not meet the case definition. So it's critical to monitor that test positivity rate. Whether we are talking about Mpox or whether we are talking about MVD, we should be around 30% also. So now in Ghana, we've seen that still the Greater Accra and Western Accra is the place that has the highest percentage of confirmed case. And this morning, when we were engaging the country team, they were also highlighting that might be the place where the need of vaccine is needed the most, but where also 74% of the population has a high acceptance for vaccine. So there still need some risk communication and community engagement to ensure that we reach the 100% as we've been seeing in other districts of Ghana. Therefore, the target vaccination campaign, which is happening currently, can actually lead to the outcome that we expect, seeing the continuation of the bending of the curve. Next slide. In Liberia, where we have also colleagues been going there on the side of the laboratory that was last week on supporting some training, but also will follow on the side of surveillance, vaccination, and case management, as the country will also receive some 20,000 doses of vaccine, which will be arriving on the 10th. So it's critical at this time to have all those efforts, especially on the Montserrado County and Nimba, because those are the ones that have the highest number of cases. Almost 70% of the cases reported are coming from there. So ensuring that the active surveillance is happening in those hotspots, ensuring that the vaccination is targeted at those places, then we will continue to see and comfortably see the decrease in the number of cases. So as you see here, the test positivity rate has decreased from 67% last week to 40%, highlighting the active surge which is currently happening in the country. So that when we see the decrease in the number of cases, we are a bit more confident, because on one side you have the active surveillance, on the other side you can see the cases that are going down. Next slide. As I mentioned, a couple of countries will be receiving dose of vaccine. Kenya has received 20,000 doses of vaccine yesterday, so they are still clearing the vaccine. I mentioned already that Liberia will receive 20,000 doses on the 10th, so that they will be all equipped. Mozambique has rolled out the vaccination on the 27th, and they are moving forward with more than 30,000 people that has been vaccinated so far. So we are moving toward the 5 million dose that has been delivered to 16 countries, and then also the LC16 that is still being used in DRC, and which will soon reach the 600,000 or 700,000 people that has been vaccinated. Next slide. Now we are shifting to cholera. As you can see in this slide, we have one new member state, Namibia, that has reported cholera this week. We'll come to that. But what you can see also is that though the highest number of cases, the highest burden of cases has been happening in the eastern part of the continent with 172,100 cases in 2025, we can see that for over the last 3 weeks, the Central Africa region has been reporting 68% of the case in the last 3 weeks. Now, we can also see that the Central Africa region has the highest case fatality rate, around 3%. So yesterday in Brazzaville, we held the coordination meeting of the regional coordinating center of Central Africa, where the different ministers, the member state of Congo, DSC, and other were highlighting the big challenge that they are facing with cholera, but also appreciating the support that they have been receiving, the technical support, but also the other support that they receive. And one thing that has been highlighted, two things actually. The first one is the key role of the community on the response. We remember one of the key drivers that we've highlighted is really the community-based surveillance, how we include them, the community health workers, but also the community leaders. And now the critical way forward is to ensure that the neighboring countries also have the capacity to be prepared, because as we'll come later, we'll see that when one country is affected, the neighboring country can also see some case coming in. Next slide. In the surging outbreak, as you can see, the top three that we are seeing in terms of increase is Kenya, Chad, and Mozambique. You can see that Kenya has an increase of 37%, Chad 20%, and Mozambique 10%. However, we have the DSC and Angola that are reporting an average of 1,600 cases weekly. This is definitely quite significant. Kenya, Mozambique, and Chad continue to show major increase in the last 3 weeks, but still the high burden context that we have been seeing, though we can appreciate the decline, South Sudan, Sudan, and DSC. Those one really remain the highest burden countries in 2025. Next slide. I mentioned that as we do speak now, we have 25 countries that are being affected by cholera in 2025, with the new country, which is Namibia. So you can see that in the district of Grootfontein Health District, that where the case has been confirmed. As we do speak now, 13 suspected case, one death, with a case fatality rate of 1%. Two districts has been affected, Grootfontein, but also the second one of Ochozonjupa region. So far there are 3 admissions. So there is a continuous engagement with the country. And if you recall, this is also the country that cleared Mpox 2 or 3 weeks ago, but also had that hemorrhagic fever case that was reported. Next slide. In Burundi, we gladly see the decrease in the number of cases. Last week we had 78. Now we have 14, 0 death. So the case fatality ratio so far is 0.4%, 11 deaths out of the 2,637 cases that has been reported. So the multi-sectorial approach in the response in Burundi is really showing result, as you can see. But then there is still more to do on the side of access to water infrastructure, because there's still some places, despite the effort or the pothole that has been implementing in many places of Bujumbura, both by the government but also by the different partner. And by partner, we mean public and private partnership. So that has been a good example. So really to strengthen, to catalyze those efforts, we have an upcoming integrated IMST mission that will come on the side of supporting the WASH, the surveillance, and the case management for cholera, as we can see here, but also for Mpox, to ensure that they can reach the last mile. Next slide. Angola, it's definitely one of the country where we are on the close look, because as you can see in the curve, we have this first first wave that happened that went completely down, and then we have that second wave which is going down slowly. We can see that from last week to this week we have a reduction of 21.8% of the case, but also moving from 7 deaths to 1 death. So far 878 deaths has been reported out of the 35,163 cases for the year 2025, which make a case fatality rate of 2.6%. So now in Angola, this is really one of the country that is challenging us on this innovative way of responding to the same disease. What can we do better? What can we do different? In the first phase, the vaccine has been used, wash has been used, but now we can see there is a second one. So the researchers are bringing us data on vaccine effectiveness, on wash effectiveness, so that we can do things differently. And then to also support the country, but also gather more evidence, we have a team that is also going to Angola in couple of days to really strengthen on the wash, the surveillance, the case management, and also have a better understanding on what innovation can be implemented so that we can really see a long-term, a sustainable decrease of the cholera in the continent. Next slide. As mentioned earlier, DSC remain really one of the key hotspot as cholera is concerned. On next week, there will be a resource mobilization conference to really bring together all the partners, public, private, NGOs, engaged on the fight against cholera. And there will be also an opportunity to think, as mentioned for Angola, what is there that we can do differently? The initiative, Fleuve Congo Sans Choléra, is also an opportunity to bring together other sectors. You recall one of the key outcome, the expected outcome of the bringing the IMST, the cholera within the IMST, is also to have beyond that the continental cholera task force, so that the champions, the AU champion, the president of Zambia, His Excellency Elichema, will be leading that, but more importantly, will be ensuring that at the country level, those presidential task force will be implemented. And therefore, they will ensure that the different minister, finance, health, water and sanitation, decentralization, will all come on board to ensure that on one side, the medical response to cholera is there, but also in the other side, the issue of infrastructure are also be implemented so that we can have a long-lasting and sustainable solution to cholera. So we also have some colleagues that we will go on the field, specifically on the Sankuru and in Kinshasa, to provide support on the wash, the surveillance, and also the case management. Next slide. In Kenya, where we do also have some team, I think the Wazi who is connected, he's currently with some colleagues in Kenya to have an integrated support on the side of Mpox, but cholera as well. There will be what we call an intra-action review, where the country will pause. And to answer the question, as cholera is concerned, what went well? They moved from one wave to the second wave. What went less well? And what should be done differently? So we have a couple of experts that will support the country on this very critical evaluation. So as you see now, we have that important decrease, moving from 41 cases to 4, 90% decrease from last week to this week. But we still have the same hotspot, Narok, Migori, and Narok County. And the same driver, the poor access to safe water, which remain, as we do speak now, the key driver. Next slide. Now, to summarize, we are happy. We are happy that the outbreak of Ebola in DRC ended with the declaration that happened in the 1st of December. We are supporting the leadership of the Ministry of Health in Ethiopia on response to the Marburg viral disease with an increased surveillance. We've showed that the testing has increased, and then we are also supporting to ensure that this increased testing is also adequate to the outbreak, to ensure that we have an efficient way a more efficient way to respond to the increase of case that is happening in Jinka, but also now in Awasa in the southern region. As Mpox is concerned, we keep on seeing the continued decline, which is still observed across several countries. The emergency consultative group will sit down on the 10th, and they will recommend to our Director General whether Mpox should remain a public health of continental security. Cholera remain a major outbreak as the cases are surging in Kenya, Angola, Mozambique, And we have this integrated approach to support those hotspot countries and ensure that we also think out of the box on how we've been responding to cholera. Last but not the least, I've been mentioning it again and again that the IMST, which is co-led by Africa CDC, WHO, other partners, UNICEF, and so on, are currently in country supporting the team so that we can really move toward a Christmas without those different diseases, or at least within a threshold that can not make crystal as a catalyzer, but rather at a time when we have our population enjoying the break. Thank you.
Thank you, Prof, for that elaborate highlights of all of the public health situations that are happening across the continent. The good news of the end of the 16th Ebola outbreak in DRC. Very, very good news considering that we're going into the end of year holiday and families will be gathering. I think that's a very positive news for the country and the region in general. And then the kind of slow balance of the cases of Mpox and the likes of cholera as we are seeing. So colleagues, at this juncture, we're going to transition to our Q&A section. Just to remind you that we still have the same means through which you can send in your question. You can use the raise hand icon on the Zoom platform, or you can write in your question to the Q&A section and they will be picked and forwarded to Prof and other members of the IMST that are on the call to be able to give you response. As Prof always say, this is the channel for accountability as well as updating the continent with what is happening in the space of public health. So let's now begin with our questions. We have two hands up this afternoon, sorry. It's in the morning to some areas, of course. Our colleague Kamer Chen is one of our regulars. He's based out of Freetown, Sierra Leone with Mana Reporters. Kamer, you have the floor.
Hello there. Thank you. I hope you can hear me. My voice is not too well.
Yes, we can hear you.
And my question today is slightly different from the usual. Yesterday, the Ministry of Health here organized a program, and it was done live. And there were very interesting comments, from the public. Many of them were bombarding officials of the Ministry of Health about some delayed payment by the Africa CDC. I think this was some work that they did, in the community mobilization or something. Details are not there, so I'd like to know if you owe any local workers here any money, and what is this about? Thank you.
Okay, Kamer, thanks for that. Prof, just before you come to responding to that question, let's take one question from our chat box here that relates to the conversation for today. This one says, with okay, it partly speaks to the situation in Sudan. As we know, there's a political crisis there. This question says, could you brief us on the findings of the Africa CDC mission, if you can, to Sudan recently, undertaken in the wake of the strike on the main hospital in El Fasher, if you have that information, Prof. So come out question in this one, then we move to the second set of two. Over to you, Prof.
Yes, thank you so much. Yes, definitely. I will answer the first question by Kemo, and then Dr. Ibrahima, that was who was supporting, or Dr. Machi was supporting the colleague that went to mission in Sudan, will be happy to provide some feedback on that critical mission. Yes, you are right, Kemo. There has been some issue with some of the community healthcare workers. You remember that we keep on saying that one of the key driver of a successful response is the community-based surveillance. And these rely on community healthcare workers. That's why as Africa CDC, we push toward having 2 million community health workers that has been professionalized and which can respond to those outbreaks. So far, we are at 1 million, halfway, so we are moving there. So the colleagues actually have not received on time because of some logistical challenge. But as you know, again, I take advantage to commend and congratulate the leadership of the National Public Health Institute, which is led by Professor Foley, with whom I've been in close communication yesterday. And then when he was highlighting that the issue has been resolved and that they will be paid through money transfer. So sometimes we had some of those logistical challenge. We really respect and appreciate the work that the colleagues are doing in the field, but it might happen in one way or the other that we have those challenges, and then we really appreciate the patience that the community health workers has been showing, but also all the people around, because when people are asking for the payment, the salary, at some point you need to be very patient. So I really appreciate that leadership, but just rest assured that things are in control and that they will be received their payment by transfer according to the discussion that I had with Professor General Fode. Over to you, Matthew, or Matthew, actually. I see that Ibrahim is no longer there.
Dr. Matthew, are you there?
Yes, thank you. Thank you very much, Nick. I hope you can hear me.
Yes, we can hear you.
Yes, thank you. Thank you very much once again. I just want to add also on the Sudan situation. As the team returned back from the trip in Sudan, we are now working on compiling all the support that was identified in collaboration with the health authorities. We have got some requests, and we are in the process of dispatching some medical supplies to Sudan. That is a process that is ongoing. And for the rest of the support, especially on the dengue fever and other public health events, consultations are ongoing, and hopefully if the final stages of dispatching the support to Sudan is reached, we will also update you on the same forum. Thank you, and back to you, Nick.
Thank you, Dr. Matthew. This takes us to the next two sets of questions. We'll take it from our Q&A section here. This one comes from Sharif Sedikan, who is a leader of the press union in Gambia. Celis asks, vaccine manufacturing and surveillance play a pivotal role in strengthening public health emergencies of continental security. Can member states drive action and devise strategies for vaccine accessibility in the fight against public health emergencies on the continent? That's Sharif's question. So talking about the possibility of member states' involvement in driving issues around strategies around vaccine manufacturing in the respective countries. The second question is from our colleague, Michael Garissa, usually with the Zimbabwe Health Times in Zimbabwe. Michael asks, Prof, in Southern Africa, the rainy season is upon us, and it is during this period of the year that we almost every year experience a recurrence of cholera. What advice will you give to countries such as Zimbabwe, Malawi, Mozambique, and Zambia, which are frequently affected and recur outbreaks during this time of the year? So those are the two questions from Michael and Sharif. Over to you, Prof.
Yes, thank you so much. Once again, I will give the opportunity of Matthew to answer the question on cholera in Southern, and it's right. This, as you've seen in the slide, this part has been the one with the highest burden of case. Those Central African in the last 3 weeks was the one leading. But with those rain, we expect to see an increased number of cases. So Matthew will tell you what is being done inside of the preparedness and then action that we advise country to do. So now going to Gambia with Sheriff on the question of vaccine manufacturing and surveillance. This is an opportunity to go back to the new vision of Africa, health, security, and sovereignty with the 5 pillars. And one of the key pillar is this one, the local manufacturing, in how we can strengthen the capacity of our member state in producing medical countermeasure, which include the diagnostic, the therapeutic, and of course the vaccine. As we started by the meeting that happened in Alger, and for showing the example of those member states that are really taking the lead, moving from 42 to 85% of the medical countermeasures that are produced locally. Algeria is really showing the trend, but Algeria is not the only one. Closer to Gambia, we have Senegal with Institut Pasteur of Dakar, who has been producing for years and years and years the yellow fever vaccine. And they've increased with Madiba the capacity to produce those vaccines, even moving toward new technology, the mRNA and so on. And we have many other countries. So really, the member states are taking the lead, and then the institution regional that we are coordinating to have that engagement with the manufacturer as we've been doing for Mpox to discuss with Barrier Nordic and see how the local production, the tech transfer can happen between them and South Africa. Unfortunately, we are not yet there because we need to recruit some funding so that we can be in a position to support the 3 to 4 million doses of vaccine that are needed to move toward that local manufacturing. So just to answer to you, yes, the member states are really driving the local manufacturing agenda. And Africa CDC, we are coordinating to ensure that we are moving in the same direction. Dr. Matthew?
No, thank you. Thank you very much, Prof. Regarding the preparedness activities for the rainy season in Southern region, what we do internally within Africa CDC, we know that the rainy season is starting. So what we do is to conduct what we call the readiness assessment to understand what capacities does the country have and where the gaps are. So based on that, we will now tailor our support and our effort together with the Minister of Health to strengthen those gaps before the next outbreak has emerged. So this activity has started some 2 weeks back, and we're in a final process to finalize all the readiness assessment. And based on that, we will work with the member state, present this finding to indicate where the gaps are, and then what effort do we need to put in place. So it's a work in progress, and we are working very closely with the member state on that regard. Thank you, and back to you.
Thank you so much, Matthew. And once again, we will remind it as much as possible. The best way to prevent cholera is to ensure that our population have access to clean waters. So once we'll manage to get there, we have countries like Angola where 40% of the population don't have access to clear water. When we reduce that number, then even if the rain are coming because the global warming is pushing toward more of those rain, even if it's coming, we'll have an environment which is conducive to reduce the occurrence of cholera.
Thank you, Prof. Thank you, Dr. Matthew, for those responses. Let's continue with our questions from here. This one comes from Mohammed Sheikh Hassan. He says, thanks, Prof, for the briefing. Unfortunately, concurrent outbreaks are ongoing in many African countries. However, could you elaborate more on Margaret in Ethiopia and Mpox in DRC? What are the risk group? I think that's the question. Mode of transmission and what control measures are in place? That's the first question. The second question, what are the potential causes of emerging and re-emerging infectious diseases? As an example, spilled over due to deforestation and the factor of climate change. So those are the two questions from Mohammed. We will let you allow you take those two, then we resume with the other questions. Over to you.
Okay, thank you so much. You are right. Initially, this press briefing was focusing on Mpox. That was the initial. And then from Mpox, we keep on adding. You've just mentioned the Marburg virus disease in Ethiopia, the Ebola in DRC, the cholera in 25 countries as we do speak now. Last week, we were talking about the Rift Valley fever in Mauritania, in Senegal, the Crimea Congo fever in Namibia, and so on. Yes, we have all those concurrent outbreak. And what we had on top of that is what we call protracted outbreaks, because usually we deal with Ebola outbreak. It takes 60 days or so, and then it ended. Now we have this Mpox that has lasted for more than a year. So it's a big challenge, which has actually taught us through the IMST and the response on how to move to integration on how we use the capacity that we have to respond to those different outbreaks. And DRC, as you asked for, DRC has shown how they were able to respond to Mpox at the same time as Ebola in Bulape, but also facing the challenge of cholera and so on. So specifically in the Marburg virus disease in Ethiopia, you were asking some few questions. So on the side of Marburg, the symptom presentation includes sudden fever, severe fatigue, muscle pain, headache, vomiting, diarrhea, and in later stage, unexplained bleeding. But the most critical is once you have some of those symptoms, we urge actually the population not to try to handle it at home, but rather to go to the health facility. And once that is done, once the care is being provided, then on one side, the patient can get adequate care, but in the other side, we can do what is being done currently. The contact tracing will find all the people who has been in contact in one way or the other with the case so that they can be provided adequate care. We can monitor them and ensure that in case any of them has any symptom or anything, they can be secure. And once the vaccine are being made available, they can also be the first one target to receive the vaccine. Now, for your second question on the spillover, the climate change, I mean, this is really one of the main challenge. We've seen that we are just closing the 16th outbreak of Ebola in DRC. And what we see is that those outbreaks may happen more and more closely. Why? Because the environment bring the population closer to the host of the disease. As we've seen, for example, in Bulape, which has been having the sixth or seventh outbreak in that region, we were initially thinking that it was the same virus that were remaining within that environment. But then the colleague from INRB, which ran the sequencing within 48 hours, gave us evidence that this was a new strain that was linked to the one discovered in 1976. What is telling us? It is telling us that the transmission still come from the animal, through the bats, maybe through the fruit bats. Maybe this is a work that our researchers are going to find out as you were following last week. Following that declaration, our Director General has supported for $1 million to support the research, not only in DRC, but at the regional level, at the continental level, on understanding the drivers of those viral hemorrhagic fever. Whether we are talking about Ebola in DRC, MVD in Ethiopia, in Sudan, in Tanzania, or in Rwanda, we need to properly understand the dynamic and how the climate change is influencing the fact that we get closer and closer to the animal, which is also a result of the deforestation that you've mentioned.
Thank you, Prof. Questions here from Pretty Patnek, who is with the Geneva Health Files. Pretty says, I wanted to know whether Africa CDC is building a coalition of countries to coordinate response on the US bilateral contracts. I think it relates to the new the US health policy, a global health policy. So the colleague wants to know if the coalition of countries that have been built or put together by Africa CDC in response to that, particularly on bilateral contracts. And just in that general view, this colleague wants to know, Arisie, besides outbreak response, is there any activity that Africa CDC is doing to strengthen the health security or health system on the continent to prevent health emergency in Africa? I think, Prof, that is a question that you can answer. Over to you.
Yes, thank you. Thank you so much. Those are very great questions, very insightful. So to the first question, is Africa CDC building a coalition of country to address the bilateral? The clear answer is no. We are not building any coalition. Africa CDC is the organization of the member state to address the issue of health. So whenever there is any issue, any conversation ongoing, Africa CDC is positioned to support the country. That's why before those missions, those bilateral missions that you mentioned started, there was a meeting with the 16 Ministry of Health that will be receiving those bilateral missions to assist them, emphasize what will happen, to emphasize that there is a common understanding of the America First strategies. So now, following all those bilateral engagement, there will be another meeting that will be called by our Director General with the same Minister of Health, and then to brainstorm on what are the overlap, what are the great added value that this strategy will bring to the continent, and also where there are discrepancy, where there are disagreement, and therefore will support the country. Remember that we are pushing for domestic financing. This is just one example. And I believe that it's something that is being shared by the member state, by Africa CDC, and somehow also by the Americas First, which we want country at some point to be able to sustain by themselves. And to address that, Africa CDC will provide 20 health economist experts that will go in some of those countries to support. So just to respond to you clearly, there is no coalition, but there is a support which is part of the mandate of Africa CDC. Now, you were asking the question about beside the outbreak response, what Africa CDC is doing to protect. I think the basics is the primary health care, which should push us toward the universal health coverage. And I mentioned that Dr. Kase apparently is in Japan to attend this high-level meeting on universal health coverage. And one of the key components is the digitalization transformation. How can we, with the 2 million community healthcare workers that we are targeting, with the different partnerships that we are signing with Starlinks and so on, how can we equip those key actors? And again, I want to commend the colleagues from Sierra Leone who have been working very hard, the community healthcare workers. Those people are critical. And therefore, by strengthening them, by ensuring that we digitalize, it will have an impact not only on the prevention and the response to outbreak, but in all the other aspects of our public health. They will be the one to support the fight against neglected non-transmissible disease. They will also be the one to ensure that there is a clear communication between the community and the healthcare system. So building a center for primary healthcare within Africa CDC is an evidence that we are really building for the long term. And the partnership that I mentioned to improve the connectivity, because there is no way you will be able to digitalize if on the other side you don't have the connection. That's why those partnerships are being signed to ensure that we have a comprehensive capacity to support the member state. So those are some few, but I really encourage you to read the new vision of Africa CDC, where you will definitely find more detail on the different pillar that we have to bring a safer and sovereign health in the continent.
Thank you, Prof, for that response. And to the colleague, the new strategic document Prof has mentioned, you can find that on our website, www.africacdc.org. Anyone can go there and access that document. Just to come back on our question. So our colleague, Kemo Chen, who opened our questioning for today, has a follow-up in relation to the healthcare workers, community healthcare worker payment. So he said, just a follow-up question for clarification, Prof. Is the delay in payment of the workers based on the part of Africa CDC or the NPHA, that is the National Public Health Authority? And following that, in other words, has Africa CDC disbursed the funds to the Sierra Leone authorities already? So that's a follow-up from Kemo just from the beginning of the conversation earlier. Over to you, Prof.
Yes, no, to be very transparent, the government of Sierra Leone have shown a very strong leadership and transparency on the fund that they've been receiving. Kemo, I'm sure that you've been able to see the the dashboards showing how the fund has been received and how they've been allocated. So now to specifically answer whether it was Africa CDC or NPH, I mentioned that the solving the issue was through that money transfer that will happen. So it's going to happen, and I think that's the most important. We should be really focusing on the solution, and then in the coming days, I think next week, if it has not happened, you will come back to us. But in between, we'll make sure that this has been happened, because we really have the strong leadership and support with the colleagues in Sierra Leone.
Thank you, Prof, for that clarity. As we wind down on our time for today, we just like to transition the conversation to the last two questions for the section, and we'll be wrapping up. So the first question in our transition say, what is Africa CDC's position and strategy in tackling malaria, a disease that arguably kills many people more than almost all of the other health emergencies that we talk about on the daily basis on the continent? That's question number one, relative to malaria. And then question number two, as we know, this week has been the observance of our World AIDS Day, still fresh in our minds. Here is a question on HIV. Apart from South Africa and its substantial caseload, Kenya appears to be experiencing a resurgence in HIV cases, as per BBC report this week. What is Africa CDC's current approach to HIV as an enduring public health threat? So the question on malaria and HIV, Prof, if you can take those, will wrap us our section for today. Over to you.
Yes, thank you so much indeed for reminding us that this the first was not only the end of Ebola in DRC, but also the time to remind ourselves that we are still dealing with HIV. A lot of progress has been made, but also a lot of challenge. Remember that the decrease of the ODE, the freeze of the USA funds, the challenge with PEPFAR has really pushed quite a number of our countries to actually invest also on ensuring that the HIV population were not dying because of the lack of access to the ARVs. So I think this time has really been a call to push on the side of the local manufacturing on one side, but also on the side of domestic financing, because these are our population, these are our people, so we need to support, but also appreciating that the brutal cut has been a real big challenge. So what we are doing in supporting, whether we are talking about malaria or HIV, is the primary health care, which I was talking about, to ensure that malaria is handled at the community level with the community healthcare workers, because the prevention is key. And within the primary healthcare, we have the immunization, whether and you know all the effort that has been put in place with the malaria vaccine. So we are pushing on one side on strengthening the community healthcare workers, on the another side, to strengthening the innovation through the evidence on the vaccine effectiveness, on how those strategies, as the vaccine is concerned for malaria, can complement, not replace, really complement all the others, the bedness, the access to ACT, the access to additives, and so on. So it is that comprehensive approach that Africa CDC is supporting. Thank you.
Thank you, Prof. and colleagues. That brings us to the end of our section for today. Thanks to all of you colleagues who have sent in your question and comments and concerns that we've been picking from our section. We're going to do this next week on the same time. At this juncture, let me turn back to Prof for the parting comments for this week as we end.
Yes, thank you, Nick. Thank you so much, colleagues, for the accountability. And Kemo, you can see how you are pushing us on the accountability and transparency side. That's the reason why we are trying to be as open as possible and trying to move towards solving problems. So thank you for that. Thank you also to our member state and all the colleagues who are fighting all those outbreaks that we've been mentioning: Mpox, cholera, Ebola, MVD in all parts of the continent. We are going toward the end of the year, so we need more courage, more engagement to ensure that we reduce as much as possible before we go into that period. And once again, thank you to the workers, the health workers, and in this case specifically, the community healthcare workers and those that we've mentioned that has been facing some challenges in Sierra Leone. We really push and ensure that with our colleague from NPHA and under the strong leadership of the Minister of Sierra Leone, that all those issues will be solved. Thank you, and then have a very good end of the day.